Savannah Guthrie is back on the Today Show this week after a brief hiatus. She left the show temporarily in December to have surgery on her vocal cords. That's kind of scary when you hear it. Our health expert, Dr. Kohli, is joining us now as we talk about this. I know Savannah discussed the surgery and can't speak for a long time, but what are the vocal cords? And they've got to be pretty important for those of us that like to talk.
Those of us who speak for a living, yeah.
They make your voice, in fact. They also protect things from going into your lungs. So when you swallow, they can kind of close over the lungs. They sit at the top of the windpipe, the trachea, which is the entrance to the lungs. And then these little bands of basically muscle and tissue. And they're called cords, but they're actually sort of bands of tissue. And fun fact, men actually have vocal cords that are thicker and longer. So that's why a man's voice usually tends to be a little bit deeper than a woman's voice. And how much air you expel out of the lungs determines the volume and the pitch. You can change the pitch with how quickly the vocal cords vibrate. So they essentially determine so much about us because our voice is such a big part of our personality.
I would imagine there are different reasons to have this surgery, but with what Savannah has discussed, what was her diagnosis? Why did she need it?
Yeah, so she actually had polyps and problems on both vocal cords. So she had a hemorrhagic polyp on one, which is a little polyp that had bleeding into it on one of her vocal cords. And on the other one, she had something called a vocal cord nodule, but think about it like a callus on the vocal cord. So she actually had, involvement of both her vocal cords, which had changed her voice. So if you listen to Savannah over the years, she had gotten progressively more hoarse.
Yes.
And she was having these symptoms of what's called voice fatigue, which means at the end of the day, you're not able to make as loud a voice or as prominent a voice. She was also having something called voice instability, which means from day to day, your voice sounds a little bit different. So vocal cords we don't really feel, but the way we sort of know that something is wrong with them is changes in our voice most commonly.
I was going to ask you that before we get into the treatment. So she probably, after a period of time, was like, I'm losing my voice all the time. It's different. How do they diagnose this?
So they did what's called a laryngoscopy, where they actually put a little camera in the nose, and then they visualized the vocal cords, and they saw those two things on there, the nodule and the hemorrhagic polyp. And then they did microlaryngeal surgery, which means they took these microscopic instruments. And the surgeon she had was describing it and saying that, the instrument was as big as the head of an ant. That's how big the tip was.
This is wild.
Because you're talking about really delicate surgery, right? Because if he cuts into the vocal cord tissue, he cuts a little bit too much, it could change her voice, it could paralyze her vocal cords, which could leave her without a voice, which could leave her honestly having chronic shortness of breath, because when the cords aren't moving, you can't get the air in.
Wow.
So this was a big deal. So you have to be really careful. And he just kind of took off just the nodule, the callus, and he took off that hemorrhagic polyp. Then she had 8 days of no talking, which is hard to do, but you have to rest because you have to recover and get the swelling down. And then she now actually has to have physical therapy for her vocal cords. That's called a voice therapist that helps her to strengthen those muscles back.
And when you recover from something like this, and it looks like the surgery went well, and she's just, on the road to recovery, are there no effects ever? Do you just go back to normal, or do you have to treat your voice in a different way?
Yes, so you have to do more voice rest. That's really important after you've fully recovered. It's also concerning because the risk factors are probably already there. And the biggest risk factor really for having this is overuse of your voice. So you guys are at risk, just like Savannah, because too much talking, too much singing. In fact, they even call it sometimes singer's nodule because singers tend to get it as well. But even things like chronic laryngitis or infections of the vocal cord can do it. Reflux, when you have acid coming up from your stomach onto the vocal cords, that can cause inflammation. So you really have to be careful about controlling the risk factors going forward, because what you don't want is more problems like this. Every time you have to have surgery on the vocal cords, it's a pretty significant thing, and the recovery can be quite prolonged.
Oh, gosh. Well, I actually learned a lot.
Yeah,
That's very interesting.
So pay attention to your voices.
Yeah, when you get hoarse.
Yes, because sometimes it happens slowly over years and it sneaks up on you like it did with her. And your family can't even tell, you can't even tell. So just pay attention to that voice and rest it at the end of the day, guys.
Broncos fans are resting their voices right now for
That's a different kind of
the off season.
Yeah.
Well, it's funny you say that, because a loud trauma, if you suddenly shout, that can cause vocal cord polyps or dysfunction or trauma. So no shouting during the games.
Right.